So the series, we ought to be able to come back within 25 or 30 minutes after we recess. Now I yield 5 minutes to the gentleman from Nevada, Mr. Horsford.
Thank you, Mr. Chairman. Good to see you, Secretary Becerra. I want to commend the Department of Health and Human Services and our entire healthcare profession. I don't care what administration, we need you to succeed so that we can crush this pandemic, save lives, get our economy back on track, kids back in school safely, and families together. So first, I'm not here to, come up with reasons to beat you up. I do believe there has to be accountability. And the first thing I want to speak to is the COVID-19 pandemic resources. As we learned from the past 2 years, the pandemic can only be addressed when we protect every single person. With an easily transmissible virus like COVID, none of us are truly safe unless everyone, especially those in our most vulnerable communities, has access to test, treatment, and an effective vaccine. Fortunately, HHS was able to do just that through the Health Resources Services Administration's HRSA uninsured program. Unfortunately, my Republican colleagues have demanded that any COVID-19 emergency supplemental be offset by other cuts. So now we are far too late in addressing the current shortfall in emergency funds that our country needs to continue to stem the damage from the pandemic. Now, I sent a letter a few weeks ago regarding HRSA's uninsured program. Sadly, that same week, HRSA announced that they would stop accepting new claims for testing and treatment in the middle of a pandemic. I don't know how that helps communities, small businesses, our economies recover when we're cutting off the very support that is needed. So, Secretary Becerra, would you be able to speak to just how crucial it is for Congress to pass an additional round of COVID relief funds to continue to protect Americans, our businesses, and along with the $82 billion requested in the budget for our public health infrastructure to continue to protect Americans from COVID-19 or any future pandemic?
Congressman, I don't know if I can say it better than you did, but and I haven't had a chance since I've been hearing all day, but I haven't taken a look at the recent numbers for today for COVID. I get those every day, the reports and the briefings, but we are now at one of the lowest points we've been at for COVID infections, hospitalizations, and deaths. And we're also at a point of running out of the money it takes to keep that fight going to, as you said, crush COVID-19. This is the wrong time. I used an analogy in a committee hearing just earlier today, saying that we're inside the 1 yard line, within the 2-minute warning of the football game, and we need that touchdown to win. And this is not the time to cut off the resources we need to go over the goal line. We know what we need to do. We've been doing it effectively. The economy is opening up. We're all here today, most of us, without masks. This is not the time to have us run out of the funding. And so I urge Congress to provide us with the resources we need, not just to do the provider relief funding for those who provide services to the uninsured, but to continue the therapies, the vaccines, the tests, the masking we need.
And I just want to underscore this. When the prior administration was in, when the prior president came to the Congress with a proposal, many Democrats, including myself, voted for that package, CARES, the family support resources that was passed. And yet now it's like under this administration, in the same middle of the pandemic, we don't have one Republican on the other side who's willing to support the American Rescue Plan or the funding that's needed to crush this virus. I'd like to finish my time talking about Title X. For too long, Title X has been woefully underfunded. There's no reason why someone's income level or their zip code they were born in should prohibit them from being able to access affordable, high-quality, community-oriented family planning or sexual health services. So my question, Secretary, is could you explain some of the adverse consequences of patients foregoing important care because of a lack of adequate funding for Title X, especially in rural areas?
Congressman, I think we all know that there are too many families in America, and COVID pointed this out even more, that don't have access to the care they need. They fall through the holes, the gaps in the system, especially in our rural and inner city poor communities. Family planning services under Title X are a life-saving service that's made available to families which had been cut off for too many, and our president has made a commitment to restore some of that funding and allow those providers to be in the game again. What we're going to do is make sure that if you're seeking family planning services, you can get it from any organization that is qualified and professionally prepared to provide you those family planning services, so we can provide those needs to rural, urban, and suburban families throughout this country.
Gentleman's time has expired. I now recognize the gentlewoman from Colorado, Ms. Boebert, for 5 minutes, and after which we will recess.
Thank you, Mr. Chairman, and thank you, Secretary Becerra. Thank you for being here today. I appreciate you coming before the committee. To start off, as a Secretary of Health and Human Services,